Welcome to 3 key requirements to prevent a heart attack or a stroke. This is the first video in a series of 3. Throughout the video, I'll refer to some notes here just to keep my train of thoughts on track, and I'll share some visual aids, slides with you as well to drive certain points. And so the first thing that I want to touch on is something that I have touched on before, and this is the idea that cardiovascular disease is a preventable condition. And for that reason, it makes no sense that it should be a leading cause of death. Despite the fact that people are smoking less and eating less saturated fat and sugar and trying to take care of themselves, it is still a going concern. And despite the fact that there is increased utilization of medications for cholesterol and blood pressure and so on. So it makes no sense. And of course, the consequences are devastating. Consequences are devastating to families and individuals. It can change people's lives in a way that they don't desire to. And so maybe there's something that we can do about this. There are 2 graphs here, and these graphs represent the mortality rate from cardiovascular disease. And actually has started going down back in the 80s, but still it's much, much greater than the rate in the 1900s, the early 1900s. The mortality rate has been going down as a result of emergency care interventions. The incidence of the disease, though, is still on the rise. This is a graph that basically shows the incidence in more recent years. And you can see the dotted line here, the yellow dotted line represents both heart attacks or heart disease and stroke all together. And that's the incidence, not necessarily the mortality rate. And so the first concept that I want to share with you, the first concept that I think is important to question, and the first requirement really, as I see it, to be able to prevent a heart attack or a stroke, is to stop chasing the lowering of cholesterol and blood pressure in the current or with the current conventional methodologies. It's really, really, really important to understand the role cholesterol plays in cardiovascular disease. See, most people think that cholesterol sticks to the arteries to cause plaque, the kind of plaque that causes blockages, which in turn bring about heart attacks and strokes. But that's not the case at all. Cholesterol doesn't just stick to the arteries. Yes, there is cholesterol in plaque, but for completely other reasons, and I'll explain these reasons in the second video. In fact, let me share some interesting facts, interesting data about cholesterol. It's interesting that most heart attack sufferers actually have normal cholesterol at the time of the event. What does it tell you then about the role of cholesterol in cardiovascular disease? When people hear that, they're surprised because the lowering of cholesterol is pushed on us in such an intense way. So this study, this one in particular, this comes from Science Daily. And this actually refers, I believe, this refers to a study from the British Medical Journal. But this is not the only one. Here you see 5 different studies that have shown the same conclusion. And these are mainstream medical journals, the American Heart Journal, Current Atherosclerosis Reports, the British Medical Journal, as I mentioned, the Journal of American College of Cardiology, and the Journal of the American Heart Association. So what is going on here? And the idea that we have to lower cholesterol, again, it's promoted intensely, and as such, also cholesterol-lowering medications are promoted intensely. And anybody who's had a heart attack is given a cholesterol medication. Even people who haven't had heart attack or known heart disease but have family history are given these types of medications. Now, how effective are they? If cholesterol is a culprit, then the lowering of cholesterol must help save lives, right? There's a concept called the numbers needed to treat. How many people do we need to give a treatment to in order to achieve a certain therapeutic goal? And in this particular case, how many people do we need to give a cholesterol-lowering medication to, a statin drug, in order to save lives? So over a period of 5 years, how many lives can we save? And if you go to this website, the number needed to treat, the nnt.com, you'll find out that only 1 in 83 lives were saved. 1 in 83 lives of those who were given with known heart disease who were given a cholesterol-lowering medication. This is not very impressive, is it? This comes again from mainstream medical journals, the Archives of Internal Medicine, the Lancet, prestigious medical journal, the New England Journal of Medicine. What's interesting also, actually, I'm going to actually switch over to the next slide first, and I'll come back to the other one. When you give statin medications to people with no known heart disease, it shows that no lives are saved. No lives are saved from giving this type of medication to people with no known heart disease just because maybe they had a family history. Whereas intervening with the Mediterranean diet produces far more impressive results. Now, you may think to yourself, it's not very impressive, but in relative terms, it is, right? 1 in 30 were helped in terms of preventing death, and 1 in 18 were helped in terms of preventing a repeated heart attack. It's quite impressive, I think, for a simple dietary intervention. And as a result of the campaign to lower cholesterol, there's this idea, a misconceived notion that lowering cholesterol is healthy for us. And it turns out that it can be quite detrimental, particularly in individuals over 60 years of age. And again, I'm not making up this information. This comes from mainstream medical journals. It seems that especially after 60 years of age, it can cause poor health and reduce life expectancy compared to people with high cholesterol levels. Okay, so again, there are several studies that have come to the same conclusion. Circulation, Lancet, these are mainstream medical journals where these studies were published. When cholesterol is lowered too much, too low, it can be quite devastating to people, especially over 60. Why is that? Because cholesterol is very, very, very important for human health. It does a lot for human health. And it is needed for the production of important hormones. Let me actually show you the next slide that speaks to that. And so let me bring your attention to this comment here, to this statement. It is essential for cells to function. Essential. 30% of the brain is made from it. It makes vital hormones, right here, and low levels result in weakness and degenerative disease. That's why people over 60 need more cholesterol than before to keep the health up. And so as a result of lowering of cholesterol, certain things can happen. One of them is the lowering of coenzyme Q10. Cholesterol and coenzyme Q10 have a common root. They're both made from a substance called acetyl-CoA. It's a substance that is needed for energy generation in our cells. And it's used for that, but it's also used to produce other substances that are important for our health, including cholesterol, including coenzyme Q10. When you interfere with the production of cholesterol, which is what statin drugs do, you also interfere with the production of coenzyme Q10. Happens to be a very important antioxidant. I'll touch on that in the next video. It's essential for cells to function, and low levels result in high blood pressure, angina, poor immune system, and low energy. And conversely, studies show that supplementing with coenzyme Q10 actually improves heart's function, even in people with heart failure, and decreases high blood pressure. Now, not telling you to run and get coenzyme Q10 supplements. I'm just providing information here. So my disclaimer is that it's not a treatment. It's the provision of information, okay? And so as a result of the interference with the removal of an important substance from the body, different side effects can occur. Some of them are listed here, not all of them, some of them. Muscle pain and weakness is one of the most common ones. And another one can be erectile dysfunction or memory loss, right? 30% of the brain is that. And so in the long run, other mental and cognitive issues can worsen, like depression, Alzheimer's, dementia, poor cognitive function as a whole. Another side effect that is not listed here is diabetes. There's an increased risk for diabetes, and there's also increased risk for liver and kidney failure. So it's important to be mindful of that. And so there is, as a whole, all of these conditions, all these side effects are associated with aging, with premature aging, decrease in cognitive decline, decrease in energy levels and motility and mobility. And so what if you can protect your heart and arteries without losing your well-being? It is possible. It is absolutely possible. So it was really important for me to attend to this misconception and explain that to you, and hopefully can understand better now that chasing cholesterol on its own without really addressing the underlying causes of the condition is not going to do a whole lot, and the data reflects that. Now, when I talk about addressing the underlying condition or the underlying cause, I'm going to start providing more details as we go along, okay? And so the next concept I want to talk about is high blood pressure. And again, you would think that because high blood pressure is considered a risk factor for cardiovascular disease, you would think that everybody who has a heart attack has high blood pressure. And in fact, about 40-some% of the people who have a heart attack actually have normal blood pressure. Still, over 60% do have, or a little less than 60% do have high blood pressure. But is it the blood pressure that causes heart disease? Or is it heart disease that causes blood pressure? What causes high blood pressure? There are two primary causes. One is hardening and narrowing of the arteries. The other one is stress. There are other causes as well, but these are the two main ones. Well, what is narrowing and hardening of the arteries? It's the process that brings about plaque development over years, accumulation of plaque in the arteries, which leads to a heart attack or a stroke. It starts with starts with hardening of the arteries. It's called arteriosclerosis. And over time, plaque accumulates, and it's called atherosclerosis. And so ultimately, high blood pressure is the consequence of heart disease, or the conditions, the circumstances that lead to heart disease. And stress is the other one. So with hardening and narrowing of the arteries, it's just increased pressure for the blood to flow through. The heart pumps the blood, and the blood flows through the arteries. With this increased resistance due to hardening of the arteries, blood pressure goes up. Excessive stress causes constriction of the arteries, and that also results in increase in blood pressure. Now, sometimes stress can cause a false presentation of high blood pressure. There's something called white coat syndrome, and that is high blood pressure that occurs only when someone is in the presence of a health professional who takes their blood pressure reading. And only under that circumstance does their blood pressure go up. And when they go back home, if they have a machine in home and they check the blood pressure at home, it's usually normal, or at least lower than the readings attained at the doctor's office. So it's important to be mindful of that, because the response to that often is providing medications. And the thing with medications is they don't necessarily treat the underlying cause of the condition. None of the blood pressure medications actually address hardening and narrowing of the arteries. Doesn't happen. They don't address that. They basically address the symptom itself. They address regulatory systems within the body that would raise blood pressure when blood pressure becomes too low. Okay. And so these are temporary mechanisms, different types of temporary mechanisms that we have that are governed by the nervous system, that are governed by our hormones and kidneys, in removing fluids, increasing the excretion of fluids from the body to lower blood pressure. These are short-term mechanisms that are built in to help keep our blood pressure within a certain range. When you take these medications for a long period of time, you're tempering with these regulations. And indeed, initially, they would produce a reduction in high blood pressure. But over a period of time, because you're not addressing the underlying cause, you're not addressing the hardening of the arteries and aren't addressing the restoration of elasticity to the arteries, which can be done, and I'll talk about in the next video, blood pressure continues rising. And so very often, and I've seen that time and time again, if someone will start with one medication, it would lower the blood pressure, but after a while, blood pressure starts going back up because the underlying cause isn't addressed. The arteries continue to become harder and narrow, continues going up. So another medication given is another medication is given, and so on. And so what's the consequence of that? Well, medications often come with unwanted side effects, right? And if you wanted to find out what are some of the potential adverse effects of your medication, you can go to this resource here. It's called PDR, or Prescribers Digital Reference, pdr.net, and type in the name of your medication in the box below here. And it will provide you with all the information that you need to know that is known about the medication, including what are the adverse effects, cautions, precautions, contraindication, interactions, and so on. And sometimes the adverse effects are really obvious, sometimes they're not. Sometimes people tolerate medications really well. Sometimes when multiple medications are added on, that tolerance goes away and adverse effects start appearing. One of the most common adverse effects is decrease in energy levels, or sleep disturbances. And often people don't think that these issues have anything to do with the medication. So it's worth your while to take a look at this resource and find out for yourself. And of course, there can be a lot more serious adverse effects as well. And medications can be effective at lowering blood pressure, but not necessarily always at saving lives. Just like I showed you with the cholesterol, here is an example of beta blockers. Beta blockers is one class of medications that is given to lower blood pressure, but also to try to protect the heart after a heart attack. And in this particular review of several studies was shown that none of the people who were given the medication were helped. And so I think that it's really, really, really important to understand that if you follow the conventional path only, without addressing the underlying cause of cardiovascular disease, hardening and narrowing of the arteries, and I'll explain what the causes of that are in the next video. Without doing that, you are setting yourself up for several problems. You aren't necessarily going to be able to achieve the prevention of a heart attack or a stroke, which is what this course is about, this class is about. But also, because of the types of adverse effects that are associated with some of these medications, your health overall may suffer as well, may deteriorate. And so this is the first concept. This is the first concept that I wanted to share with you. And in the next video, I will speak about the second requirement. I'll speak about what actually causes hardening and narrowing of the arteries.